Institute of Extended Studies, enhancing provider and staff schedules to increase revenue. My name is Mark Wesson, and I'm happy to take you through this very important topic in healthcare operations and effectiveness. Today's provider practices and hospitals are under stress from many angles, both internally and externally. And appointment and provider scheduling is a single but mighty factor in long-term success. The scheduling approach chosen is a strategic, single, and outsized contributor to practice revenue success. A misunderstood or poorly implemented schedule in a provider organization can impact operational frustration, staff turnover, expense and time management, and proper use of professional services and time. What used to be a dependably structured and relatively static list of what or who is up next is now a more dynamic set of expectations and a system at that. Physicians in a normal practice may also do other activities like lectures or operating procedures, hospital rounds, or consults with other clinicians, planned or unplanned, that make each provider schedule something that needs constant curation to ensure preferred and optimal uses of time. While having such broad potential for positive and adverse impacts on practice success, it is both an operational tool and also an informational goldmine and a complex matrix for studying practice activities of interest. Scheduling patterns give useful insights into what is really happening and aid creativity and generating revenue for the office. For example, by identifying and quantifying patient loads by provider with, available or unused capacity, and for offering additional services not currently on the schedule, but in the scope of practice for the provider and that offer attractive reimbursement rates versus timing, effort, and materials expended by the provider and staff in order to accomplish, finding enough patients for new services. In this online seminar, we will discuss lessons and strategies for better scheduling and organization to encourage smoother operations and increase revenue. After this online seminar, you should be able to explain tips for organizing providers' daily schedules, utilizing your available resources to maximize efficiency and staff satisfaction, and automated scheduling solutions that exist to save time and effort. Scheduling appropriate healthcare services is a complex issue that requires the balancing of clinical criteria and acuity, patient needs, and organizational resources, structure, and culture. The science of optimizing access and wait times is still evolving, with little comprehensive measurement of wait times for appointments, or with targets that are often pragmatic, although sometimes personal preference driven, reflecting practitioner staff, room availability, and cost, as opposed to being evidence-based. Many organizations, such as the Institute for Healthcare Improvement, have recommended that the third next available appointment model is a good one to look at, meaning to decrease the number of days to the third next available appointment in primary care down to 0, and to get it in to 2 days wait time in specialty care. While these components are measurable, many other confounding factors influence these capacity of health systems to offer appointments in a timely manner. And perhaps, sometimes one could see the IHI's targets as a little bit aspirational. Looking beyond the challenges in the ambulatory, primary, and subspecialty environments, hospitals and rehabilitation centers also have their own struggles with scheduling and prolonged wait times, causing patient and provider irritation, operational inefficiencies, and increased cost. These healthcare settings also require nimble and documented scheduling approaches. System complexities add a further layer and can appear overwhelming to unbundle sometimes to staff. Multiple ongoing quality improvement efforts are occurring in clinics, hospitals at any one time. And in these places, the setting, the staff, the processes are constantly changing, and the targets are possibly also changing as well. Often competing incentives get involved. And sometimes the lack of coordination in the continuum of care and for providers working together in the same reimbursement schema, coordination can be difficult to attain. Prolonged wait times and access deficiencies also had negative impacts on providers and staff, often unacknowledged. Inefficiencies and workarounds existing throughout healthcare contribute to excess costs, duplication of effort, lack of coordination across the continuum of care, dissatisfaction, and burnout, especially in primary care. So spreading best practices in scheduling and access may help to reduce professional and team frustration and help rekindle provider and staff joy and satisfaction for patient care. Scheduling aims to improve the match between healthcare resources, doctors, nurses, rooms, equipment, medicines, other implements of healing, and patient needs. A good scheduling system reduces waits for patients while also improving the utilization of critical and scarce resources. It does this by tracking the availability of resources, projecting future demands for services, and automating the assignment of resources to needs. The average phone call to schedule an appointment with a patient is about 8 minutes. Offering patients multiple ways to schedule and manage their appointments will save you and your patient some well-deserved time. Systems can send automated texts to patients with appointment reminders or confirmations or requests to reschedule. Or they might be notified if an earlier spot opens up, if they'd like to change their appointment to an earlier one, which in turn opens up a slot for someone of equal or greater acuity, or perhaps less acuity. And if they would like to have an opportunity to change their appointment to something later, maybe that will do it. So that may be a way to free up your appointments on your schedule for your wait list, or to fill with additional types of services. Automated scheduling solutions don't require staff involvement, automatically improving problem triage and improving patient access. Should a cancellation occur, systems can identify appointment slots, types, and time intervals so that providers, managers, and staff can analyze and prioritize the time urgency of patients' needs to free up or consolidate other time blocks for greater efficiency. Using email to manage staff and provider time off requests is a feasible, reliable, and accountably documented process in healthcare management. Think about how easy it is to lose an email and the vast amount of email that you get each day. Not only do you have to notice that in an email, but remember where it is, and then integrate the time off request into the system that you're using. It's inevitable that the request here and there is going to be misplaced. Automated scheduling software can do that for providers as well. Scheduling software offers scalability needed as the organization grows. Provides a digital record of each schedule so doctors and those who support them can have the most current version of the schedule at their fingertips. It provides an opportunity to double check the patient scheduling system. And it also stores and automatically integrates into systems as well, if that's something that you'd like, so that the time off requests aren't lost again. So a couple of best practices here to talk about some things that seem to work well for practices. Grouping appointments for patients with similar conditions on the same day helps medical staff get into a slightly more consistent rhythm, cognitive rhythm, thinking along the same lines, that sort of thing, so that they can diagnose and treat more efficiently. If doctors are able to remain focused and stay in that same cognitive medical mindset, it enables them to make faster diagnoses, allow for less complexity and time per encounter. Let's face it, we're all busy. Just like patients, we do our best to balance all life's demands, and sometimes things fall through the cracks. Things like a scheduled doctor's appointment. So by sending patient appointment reminders, you reduce no-shows dramatically and go far in preventing unused scheduling capacity. This helps to ensure that your patient arrives on time, keeping your day's schedule on track. It also provides one more opportunity to reschedule to another time and possibly free up the appointment slot for another, perhaps more urgent patient. As you are painfully aware, having a patient not show for an appointment is costly and frankly inconvenient for you and your office staff, and is especially true if you have a long wait list. When a patient doesn't show, you as the provider are not the only one to miss out. Your other patients miss out too. So consider investing in automation for your reminders. Having an automated system that sends out text messages or phone reminders will save you and your office staff time. With any great customer service comes a season. And knowing the season for your clients, patients, is very important. It'll help you to anticipate scheduling. A great example of something that pediatric practices know quite well. There tends to be an increase in needed appointments at the beginning of the school year or just before. Your particular practice may see an increase in needed appointments based around when deductibles have been met. That may typically be towards the end of the year. By analyzing these sorts of patterns in your schedule, over time you'll be able to maximize your schedule to create access for those who need it most or can use it most. And will allow your office to be a little bit more focused about scheduling. Finally, give your patients early arrival times. Keeping your schedule on track begins at the very start of the day. If you have your first patient scheduled at 8, it's probably helpful for them to be there at 7:45. Just to complete paperwork, that sort of thing, do exam room entry, accounting for the patient's pre-visit paperwork and accounting for that in your exam room entry timing and paperwork time required afterwards would be helpful. Starting late, even if it's only by 10 minutes, can have a snowball effect, even by midday, if not certainly by the end of the day. Once in the office, your patient will go through clinical intake through the front desk, likely needing to complete documents, depending on your practice's preferences and for length of paper and depth of info. Accounting for this interval in your time management allows a better shot at keeping the schedule on track. A great way to account for this time is by giving them that early arrival time, as I mentioned. If you set them between 10 and 30 minutes, again, depending on your preference, you're probably doing quite well. Keep in mind, it's important if patients are using their time to show up early, then the clinic staff and the clinical staff should stay on time. Nothing turns a patient away quicker than the perception of not having their time valued. Computerized scheduling systems are a method of using scheduling algorithms and rules to help multiple people manage appointments and meetings. Automating and optimizing the process of creating and maintaining healthcare employee schedules and patient schedules is what we will explore a bit here. Medical staff scheduling is an internal solution. That is its main distinction from patient scheduling software, which is an external solution that provides patients with a portal or tool to book appointments with their physician. Healthcare organizations that leverage medical staff scheduling solutions reduce scheduling friction, effectively manage resources, account for scheduling and availability regularities, boost employee morale, and improve patient care. Computerized scheduling allows users to publicly share free time on their calendars while keeping specific appointments private. They tend to be more efficient than manual scheduling, but a good appointments assistant can more effectively handle some situations. Computerized scheduling works very well when all participants are committed to keeping their calendars current, not just some or most. When some users of the system are unaware of how to keep their calendars up to date, the system can fall apart. For example, in the doctor's office example above, if a doctor schedules an offsite appointment but fails to mark travel time as unavailable, too much time will appear as available and in the home office's view of the schedule. In these cases, a combined method of computerization and confident scheduler can keep things in order. The pen and paper to computer method is the old way of scheduling appointments for the provider work group, probably still quite common though, in which all scheduling is blocked or unblocked through an appointment keeping assistant who then enters it into some form of central computerized calendar. In this model, providers must check in regularly to find out what their schedule is and let the assistant know what times they wish to be unavailable. With large work groups or very busy schedules, the system can rapidly become untenable. Many people still believe that manual scheduling is the best way to create general on-call schedules to their practices or hospital departments. In small offices, departments, manual scheduling is probably a manageable process, but in larger growing organizations, manual scheduling is this unscalable, stress-inducing process. Manual scheduling is not scalable for several reasons. First, with each new provider or staff addition that you add to the schedule, you add work at multiple levels. And you open the provider and the staff to mistakes. Each person you add needs to have their rules defined, their blocks taken care of, their time and day blocks understood by the staff, request processed, equity calculated, scheduled, distributed, and much more. At each stage in this process, there is an opportunity for error and can lead to confusion and wasted time. Secondly, manual scheduling is not scalable because the schedule simply does not get easier as it expands. The keys to good scheduling in healthcare are systems, software, data, analytics, culture, and management. Data transformed to analytics provides insights into historical trends and helps to forecast scenarios that may improve how things are done, answering such questions as how long will a particular procedure take for a given patient with a given doctor on a given day? How many patients can we expect to present needing care in the emergency department on a given day of the week, time of day, or day of year? How likely is it that a particular patient will be a no-show for a scheduled appointment made X or Y number of weeks in advance? Supportive culture and management are essential to implementing any new system for healthcare scheduling. Without support from the top and the people who are impacted by the schedule, needed changes will not occur. Each scheduling application presents somewhat different issues. In surgery, it's critical that all the needed resources are accounted for. People, equipment, implants, carts, and room scheduling as well. Because these resources do move around a lot, operating room scheduling is a synchronization and coordination challenge, to say the least. Keeping people on track, both patients and clinicians, is the first problem tackled by scheduling software. Appointment scheduling systems automate reminders and make it easier to fill voids, improving efficiency and applicability, which suffers when patients don't show up. While the tactics and environments of care may differ, each example reflects the underlying recognition that prolonged wait times are a symptom of a larger system-related issue, not amenable to the simple, personnel, one or two, or quick fixes. The measurement of supply, demand, and capacity, attention to process redesign, the use of lean, the move to a person-focused system, and the willingness to experiment and change continuously rather than rely on increased resources are essential components of the organizational change process in healthcare today. Together, they provide evidence that scheduling problems are not only solvable, but that solutions are also within reach of organizations of all types. Improvement in each hospital or clinic starts with evaluation of the current process, determining its capacity or its capability as the stepping off point for all other activities. A cardiology clinic that only has a cardiologist present one day a week will have a very different set of capabilities from a group practice that sees patients every day, all day. Expectation setting should be based on system capability, not used as an excuse or an opinion. And in a culture of continuous improvement, capability should have ongoing management. Setting metrics without these aspects being clearly defined will likely lead to gaming of the system and dissatisfaction for all involved. So to conclude our discussion, the appointment scheduling in healthcare can take up a large amount of time for providers and their staff. By investing in automated scheduling technology, you can find scheduling that works for you and your patients. Patients want more access when it comes to scheduling their appointments. Working with an automated system, which works without staff involvement, will save practice time and money. By decreasing the unused scheduling capacity within your schedule, you and your patients win. Working with an automated system will also allow you to keep your patients informed. With reminders and alerts, your patients will miss fewer appointments. Automation will allow for easier rescheduling when an appointment is canceled. And finally, effective scheduling will increase revenue. Thank you very much for your time. You may connect with AIES on social media, LinkedIn, and Facebook. Again, thank you very much.